among women leaders. What more can you tell us?
Well, a very good morning, Michelle. And as you put it, the County First Ladies Association is in town, being ably represented by their chairperson, Nazi Kibwana, who is the wife to Makueni Governor Kivutha Kibwana. So she is here together with the team with the aim of having a discussion towards really mitigating the cases of cancer, not just in Kisumu, but in the entire country. This is an initiative that is named Empowering, Enabling, Motivating Partnerships Owned by Women to Engage and Reclaim. And this is an abbreviation for Empower, meaning that it's a team that is out there to ensure that the cases of prevention, cases of early diagnosis, treatment with standard care, together with educating women in the community on breast and cervical cancer cases is done to satisfactory levels. So, Michelle, we are talking about this particular meeting that will culminate in a visit to the Jaramogi Oginga Odinga Teaching and Referral Hospital later on in this before midday. And we have really startling statistics regarding cancer cases, not just in Kisumu and Nyanza, but also in the entire Republic. Talking about the Globocon 2018 report that portrays the kind of scenario that we have when it comes to cancer cases, the diagnosis, and the various types of categories and the percentages. We have the breast cancer, when we look at the country overall, coming at 12.5%, followed by cervical cancer at 11%. Then we also have esophageal cancer at 9%, and then the colorectal cancer comes at 4.8%. So these are some of the major cancer cases that are affecting Kenyans from all walks of life. From the recent happenings, it has become apparent that this is no longer a preserve of those who are wealthy in the community. This is now a scourge that is now affecting every other Kenyan, and those are the glaring statistics. Apart from that, of course, we have other cancers accounting for 56.6%, still while referring to Globocon 2018 report on cancer cases in the country. So this particular meeting is supposed to ensure that we have a baseline surveys being done in Kisumu and 7 other counties, and these other counties are Bungoma, Nakuru, Kakamega, Laikipia, Meru, Taita Taveta, and Makueni. So this particular team of County First Ladies Association, together with the Roche, which is another organization that works towards mitigating cancer issues and also health issues. We also have Women for Cancer, and then we also have Africa Cancer Foundation. All these organizations are supporting this particular initiative by the First Ladies Association in the country to ensure that this particular fight is fought to the fullest. Remember, it's about prevention, early diagnosis, treatment with standard care, and also educating the masses on what they need to do when it comes to prevention of the various types of cancer cases. And also, when you talk about early diagnosis, then it means that will be really a good step towards fighting this scourge that is biting Kenyans. Remember, Kisumu County government has been planning to have a cancer center at a tune of 1 billion shillings. And remember also, it is Kisumu Governor, Professor Anyong' Nyong'o, while he was Medical Services Minister, he went public at a time that not many people in Kenya were ready to do so, and say that he had been diagnosed with prostate cancer. And this is something that he's fought to the best that we can say, because thank God it was apprehended at the right time. And of course, this is good news when it comes to the fight against cancer, given that he is also affected directly as a governor, and given that he's now the host of this particular delegation that is trying to ensure that this particular fight against various cancer cases is done to the best way that is possible. So what I'm made to understand is that, first of all, this particular delegation is going to have a courtesy call at Dorothy Nyong'o's office in Kisumu here. And then after that, we'll have various speeches from various stakeholders. We'll have the CEC in charge of health at the Kisumu County giving their speeches, and after that we will have that visit to the oncology center at the Jaramogi Oginga Odinga Teaching and Referral Hospital. And of course, from there we'll get to know what they've been able to observe so far regarding what kind of improvements need to be done at the oncology center, the Jaramogi Oginga Odinga Teaching and Referral Hospital, which, as the name suggests, gets referrals and also treatment cases from all over the region. So this we'll be keen to get to know what kind of input, what kind of support they would like to give Jaramogi Oginga Odinga Teaching and Referral Hospital as the institution keeps receiving more and more cancer cases from the region and also the nation at large. So from here we are heading straight to Jaramogi Oginga Odinga Teaching and Referral Hospital to get to hear more from Nazi Kibwana, who is leading this delegation, and also from other stakeholders on what they really have to say regarding the kind of support that they will give to this institution as they move towards fighting this scourge that is cancer. Back to you in studio.